Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Torres, who is a cosmetic dentist. Hi, how are you?
Hi, how are you, Emily? Thank you for having me.
Of course, thank you for joining me. I'd like to start off by asking what influenced you to pursue a career in dentistry?
Yes, absolutely. So I started my journey in dentistry at the early age of 15. So I went to a vocational high school. What a vocational high school basically is you go in, 1 week is a trade or you take a shop, and the other week is academic. And my freshman year, I rotated through many shops, electrical, cosmetology, and I ended up loving dental assisting. So during my sophomore year of high school, I became a dental assistant, and then the rest is basically history from there. So I dental assisted for about 18 years throughout high school, college, and I applied to college with the notion that I was going into dentistry. So I knew very, very early on what my career path was going to be. I knew very early on that I wanted to be a dentist. It was just a matter of how I was going to get to be a dentist. I grew up in a predominantly Latino community. So none of my family members had gone to dental school, finished college, or any of that. So a lot of it was research, trying to find mentors that could help me. And I finished college in 5 years. I didn't finish in four. I took the dental admissions exam and I ended up at Howard University College of Dentistry in Washington, D.C. Went to Tufts University AGD program. I did a 1 year residency after school and started working as a dentist afterwards in 2017.
That's amazing. I actually have a similar story as well because I've been interested since I was like very little. I'm now working at a dental office and like getting experience in it and hope to pursue it. So
Of course, that's how you start. You just got to keep going.
yeah. And why did you choose your specialty?
So that's a great question. So I was dental assisting for general dentistry for many years, and I decided that I was getting bored of assisting in general dentistry. I think there's a flip side to it because obviously being an assistant is a little different from being a dentist. So did that for many years. And then I decided to go into oral surgery assisting, which is very, very like go, 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 a lot of surgery, a lot of different procedures, a lot more blood. It's just different, right? So when I applied to dental school, my whole thing was I'm going to go into oral surgery. And that's what I thought I was going to do. So I studied really hard. I graduated second in my class of dental school because I thought I wanted to be an oral surgeon. Soon as I started my third year of dental school, I started the clinical portion and I realized how much I really, really love general dentistry and specifically the cosmetic portion of general dentistry, like doing composite veneers, porcelain veneers, all of that. So that really is what kind of drove me to more cosmetic dentistry and basically not even going into the oral surgery aspect of it. So I even took the oral surgery exam, like entry exam, my third year of dental school. I did very well, but my fourth year, I was like, I'm just going to apply to a advanced general residency program. And that's exactly what I did. And I don't regret it at all.
That's great. Can you tell me a little more about your profession and like what you do?
Sure. So currently what I do is I do a lot of what we call restorative dentistry. But what I like to do is I like to call it comprehensive cosmetic dentistry because I really, really love doing a lot of cosmetics. So working on the front teeth, helping my patients overcome insecurities, helping them build their confidence through basically changing their smile. So if patients have cavities, I'll take care of that. So that's what we call restorative dentistry. So basically fillings, any crowns that need to be done. So a lot of that is what I do. I also do the cosmetic portion, like the front teeth. I also do implant crowns. So a lot of my dentistry is mainly driven around the comprehensive aspect because I do want to make sure that my patients are obviously healthy. Like obviously healthy mentally from a self-confidence aspect, but also healthy orally, meaning inside their mouth before we even start any cosmetics.
Yeah, and that's incredible. What do you like most about your profession?
Most about my profession. I think what I love most about dentistry is that there's just so many different things that you can actually do in dentistry from being an associate dentist. So you can literally work for somebody else, create your own hours, and be able to, live the life that you've always dreamed of. So basically, create the life that you've always wanted.
Mhm.
If you don't want to be an associate, you could also be an owner. You could be an entrepreneur. You can own multiple businesses. You can own one practice. There's just so many things in dentistry, and there's so much flexibility in dentistry that I absolutely love. But one of the major things that I really, really love is being able to connect with my patients and being able to make that positive impact to my patients. I think that's super, super important, and it's really beautiful.
Definitely, that's very amazing. As you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic? Like, did the way the treatment was provided change?
Yeah, so during COVID-19, our office decided early on that we wanted to shut down. We shut down for about 2.5 months here in the state of Massachusetts. Um, and then we gathered all the PPE we could. We came up with new protocols, new systems to make sure that our staff and patients were safe upon return. So it was very, very different from like wearing shields, wearing gowns, telling patients to sit in the car when they used to normally sit in the waiting room. There was just so many different systems that we had to put in place in order to effectively keep our team safe and also keep our patients safe. So from that aspect, it was challenging because there was just so many changes happening in such a short period of time. The other thing was basically the unknown of the virus, right? The unknown of the COVID-19 virus at the time. Dentistry has proven over many, many years that the transmission of basically hepatitis B or HIV or any other virus is very, very low in the field of dentistry when using proper precautions that were already instilled and using proper PPE. So thankfully, we haven't seen, and there hasn't been any studies to my knowledge, that in the dental profession, in the dental office, that it's easily, COVID-19 is easily transmissible between staff and or staff provider and patient. So I think going in, having the time off, I think I was a little apprehensive, but once I was in wearing my PPE, treating my patients, I realized that the transmission rate for dental professionals is honestly really low because thankfully none of our team has gotten sick.
Yeah, that's great.
Mhm.
I see like in the office that I work with in, there's definitely like protocols that are different from the beginning of the pandemic to now. Because like,
Right.
yeah. So and it
And buttoned up too, which is really nice because we realized that we don't need all of this. We've taken temperatures on our staff, we take temperatures on our patients.
definitely.
So a lot of the protocols that were like super tight in the beginning, now we can kind of cut back on.
Yeah, and that's great.
Yes.
Um, to end off, can you give a few words of advice to the people of my generation hoping to pursue a career in dentistry?
Absolutely. So one of the first things I would say is like 100% is to make sure that you absolutely love dentistry because it is a long journey.
Mhm.
So don't be shy to volunteer. A lot now that COVID has, not saying it's gone away, but now that we have proper protocols and PPE in place, a lot of dental offices are allowing you to shadow. So it wouldn't be a bad idea to either A, call the office directly, check online to see if there's an email that you can email the management or the owner doctor, and just reach out and say, hey, I'm a pre-dental student. I'm very interested in shadowing. I've checked out your work. I checked out your Instagram. I would really, really love to come in and possibly you can mentor me through this process. I think that's step one. I think that's very, very important because you need to know what dentistry is. You obviously need to see it firsthand. And even if you can get hands-on, like assist or work in the sterilization department, anything will kind of give you an idea of what it really entails. The other thing is you want to start preparing yourself for that. So whether you're in high school or in college, for high school students, it's the shadowing, obviously preparing your application, your pre-dental application for college, making sure that you start having connections, whether it be with other dentists or other pre-dental students.
Mhm.
If you're in college, you want to start obviously preparing for the dental admissions exam, whether you need to get, a tutor to help you study effectively, start reaching out to, your professors for helping you with your personal statement, recommendations. All of that is super, super important. The one of the major things is I know one of the major things that I wish I knew was the amount of effort and the amount of actual work that is going to have to go into becoming a dentist, because it's very rewarding at the end, but you have to stay focused, you have to stay determined, disciplined. So reading a lot of books on personal growth and personal development and mindset, or even listening to YouTube videos will really, really help you get through that process. Because not only do you have to be all of those things I mentioned, but you have to be mentally fit in order for you to get through the process, because that journey isn't going to just be smooth sailing. There's going to be maybe multiple bumps in the road and, some failures, and maybe you get rejected first year and you don't get into dental school first year. And I'm not saying that's going to happen, but it can happen. And you have to mentally prepare yourself for that. For instance, when I applied to dental school, when I was applying, I took the dental admissions exam 3 times. And for those that don't know, you can only take it up to 4 times. The fourth time, you need special permission. And my grades were, academic averages were not good at all. So even like a simple example like that, you just want to make sure that you're mentally preparing yourself for this journey.
Mhm.
Um, and that's the best advice that I could give you. Stay resilient, stay determined, stay disciplined, and create great habits. Like, you want to set yourself apart from everyone else, especially if you want to be I always think, and I always say this to everyone, you want to be the best you could be. Um, yeah, that's the best advice I could give you.
Yeah, thank you so much for the great advice. And those are all the questions. So thank you for joining me here today and thank you
Thank
for your time.
you. Thank you.